As the war in Gaza grinds on, this is all culminated in what the UN says is a hunger crisis.
Most of the people I speak to say they sleep hungry, they skip meals because simply they are not available.
The question isn't whether many Gazans aren't getting enough to eat. It's clear they're not. But the language used to describe the severity of the crisis can impact the global response. At the end of July, the United Nations reported that, quote, 2 out of 3 famine thresholds have been reached in Gaza, plummeting food consumption and acute malnutrition. Mounting evidence of famine, they said. But because they were unable to demonstrate deaths due to malnutrition, they couldn't call it that.
They can't call it a famine just because of semantics, really. People from different UN organizations have been there, have talked to people, and they come back and they say, yeah, we've never seen anything like this. They told us 1/3 of the population isn't eating for days at a time. The number of children who has died from malnutrition has surpassed 100 since the war started. And they say that 300,000 children are at severe risk of acute malnutrition. So it's really, really bad. You can't call it a famine, but it doesn't matter. It's getting there.
Part of the disconnect between the situation on the ground and how it can be described is due to the blocking of journalists and aid groups, and also to the dissolution of Gaza's healthcare system. Gaza's health ministry is run by Hamas, which has made it more complicated for international groups to trust their published figures. This is The Big Take from Bloomberg News. Today on the show, we bring together reporting from around the globe to understand how a hunger crisis unfolded in Gaza, despite months of warnings, and what it would take to end it.